My name is LeeAnn Lucas, and I'm a PhD student in the Cancer Epidemiology and Prevention program. During my undergraduate studies at the University of North Carolina, I thought that I wanted to pursue a medical degree, so I worked as a nurse aide in a local hospital to gain experience. Every shift, I saw how deeply a cancer diagnosis can affect patients and their families, and I realized that I wanted to focus on preventing cancer before patients got to the point of being in the hospital instead of treating the disease. I started asking questions about whether healthier environments, more accessible screening, and stronger prevention programs could have helped these patients. I ended up getting a bachelor's degree of public health in environmental health science, and then had the opportunity to work as a research fellow at the CDC in the National Institute for Occupational Health and Safety. When I was deciding where I wanted to continue my studies, I knew that I wanted a strong foundation in epidemiologic methods, and HSPH is really the place to be. We are able to take classes from leading scientists foundational to the field, both in causal inference and in cancer epidemiology. During the first years of my master's, I was not sure what health outcome I was most interested in until I took a course called Cancer Prevention, taught by Dr. Stopsack and Rebick. What really opened my eyes from this course was learning how much of the global burden of cancer is actually avoidable. We learned the biology of cancer, but we also learned about the role of public health through interventions, policy changes, and even communication that can help reduce cancer risk at the population level. We learned about the biology of cancer, but also about the role of public health through interventions, policy changes, and even communication that can help reduce cancer risk at the population level. I was able to see that there are many opportunities to make an impact in preventing cancer. My research focuses on understanding the factors causing bladder cancer. Specifically, I'm interested in environmental causes of cancer, such as arsenic, pesticides, and PFAS substances. In New England, there's a 20% higher rate of bladder cancer compared to the rest of the United States, and recent studies have shown that arsenic found in well water throughout the region may be one of the factors leading to this increase in disease. My research will focus on how to mitigate these effects to prevent bladder cancer and to identify populations who are most at risk. A second focus of my research is sex differences in bladder cancer. Males are 4 times more likely to be diagnosed with bladder cancer. However, females are diagnosed at later stages, meaning that their outcomes can be worse. It is not entirely clear what causes these sex disparities, and we are working to understand these issues with the hope that we can prevent bladder cancer incidence and mortality. The academic environment at HSPH is extremely collaborative. Both students and faculty are passionate about public health and are willing to work together to make the greatest possible impact. In addition, HSPH is unique in that we also have access to many great data sources, including the Health Professionals Follow-Up Study, which is one of the data sets many students in my lab have the opportunity to work with. This study has followed participants starting in the 1980s and has collected data on a range of risk factors and health outcomes, including cancer types and stages. HSPH is very diverse, and I've had the opportunity to meet and learn from students from a variety of backgrounds and from many different countries. HSPH also has many international collaborations and opportunities to work around the world. During my master's program, I was able to spend my winter break working with partner epidemiologists in Sweden using the Swedish National Cancer Registry data. There are a few different stages of being in the PhD program, so I would say my day-to-day life will be pretty variable over the course of the program. The first 2 years is mainly coursework, and most of my time was spent in classes, completing homework, studying to get a solid foundation in study design, data analysis, and causal inference methods. During this time, I was able to meet and connect with many professors and other students. While I was taking classes, I was also a teaching fellow for some of the Introduction to Epidemiology courses and was doing research part-time with my advisor, which helped to bridge my learning between coursework and research. I am just starting to enter the next phase of the PhD program, which I will be conducting research full-time to complete my dissertation, and will dive deeper into specific risk factors that cause bladder cancer. This will likely consist of many meetings with the Cancer Epi team, data analysis and coding, and literature reviews. This stage of the PhD seems to be very flexible, where some students can continue to teach courses or have the opportunity to complete projects or internships with various research institutes, such as the National Cancer Institute. There are a few things that really stand out to me about the program. First is the mentorship. I found an incredibly supportive group of mentors who are invested in my growth, both as a researcher and as a person. My lab, including the other students, postdocs, and researchers, has provided me with an encouraging, uplifting space to ask questions, collaborate on projects, and build community. The Cancer Epidemiology and Prevention program also has strong collaborations at Dana-Farber and different hospitals throughout Boston. These partnerships have provided me with a great opportunity to learn from and collaborate with clinicians to help improve research translation and to make a real-world impact. Another highlight is the program's interdisciplinary nature. Projects often bring together perspectives from epidemiology, clinical medicine, statistics, health policy, and more. This broad approach ensures that students are exposed to a range of ideas and methods, preparing students to think about cancer prevention in a more comprehensive way.